All right. Hi, everyone, and welcome to our panel discussion on a very important topic, relative energy deficiency in sport and dance, or REDS D. This panel is specifically aimed at those on the more artistic and organizational side of the dance world, and basically for anyone on any level, in any educational institution, as well as on any continent. Be it teachers, leadership, and other staff, anyone who works closely with young dancers on a daily basis. We believe that you are quite uniquely positioned to not only influence the students' artistic growth, but also play a very important role in their health and well-being. Today, our task is to try to help you and support you to best fulfill that role. My name is Daan van Akker, and I'm very happy to serve as your moderator today. But I'm not planning to speak a whole lot. I will leave that up to our three excellent speakers today. I'm excited to introduce to you all three, each bringing invaluable expertise to this conversation today. I'll start off with Dr. Rachel Barr. She's the Director of Research and Health at Canada's National Ballet School. In this role, she oversees the school's artistic health department, as well as the Research Institute. After dancing professionally, Rachel completed her PhD and clinical training in psychology at Toronto Metropolitan University. Her research broadly focuses on dancers' mental health, including eating disorder prevention, as well as dance for health across the whole lifespan. When time permits, Rachel enjoys teaching dance to all ages, as well as providing educational workshops, all to help youth dancers develop important skills for life in dance. By the way, she's also one of the driving forces behind this project today. Secondly, we have Matthew Squire. Matthew trained at the Royal Ballet Upper School and then danced for about 12 years in a number of German theaters. After his career, Matthew retrained as physiotherapist, and since November 2013, he has been body awareness coach as well as head of health at Palucca University in Dresden, Germany. With his wealth of experience, he promotes dancer well-being through coaching, through rehabilitation, and safe dance practices, often directly with the students. Last but not least, we have Dr. Nicky Keay. Dr. Nicky is a renowned medical doctor. She studied at Cambridge University, and she has a specialist expertise in the field of dancer hormone health. She is a passionate advocate for health in dance and an absolute expert in the field of REDS D, the topic of today. Maybe even more importantly, she dances herself and comes from a professional dance family. Therefore, she knows what it's all about. Together, we'll explore how you, our audience of dance educators, leadership, perhaps even other staff members, can play a positive role in supporting the health and well-being of your students. So let's get on our way and maybe start off with a quick recap. Rachel, would you briefly remind us what REDS D is? And maybe slowly start to relate that to the dance teacher.
Okay, sure. Thanks, Dan, for the lovely introductions. So if you've watched the keynote, you'll have heard more of the details, but just to recap and broadly, REDS D is a cluster of symptoms, a cluster of experiences that you can experience in the short and long term that are a consequence of being deficient in energy. And so for dancers, obviously, they're spending an enormous amount of energy training, performing. If we're talking about growing youth dancers, we're talking about also the energy needed to grow. And so this puts our dancers at an elevated risk of being deficient in energy. And what that causes is a variety of issues. So first of all, the physical symptoms of somebody who's deficient in energy, we might see delayed development, delayed growth, is something you might see as a dance teacher. You might see low energy, poor strength in class when you're training somebody. You might see somebody not able to jump high. But I also want to just highlight some of the psychological, some of the emotional things you might also notice. Somebody experiencing REDS may be a little bit more slower cognitively picking up exercises, taking in corrections than maybe they have in the past, if it's a change and it's a new experience as they become deficient in energy. They may also withdraw, right? When you're low in energy, you're trying to conserve that energy. You may or may not be conscious of that, but maybe more withdrawn in class. And this can also affect affect, right? Your emotions. So you may notice somebody is a little bit lower in mood than maybe they've been in the past. So all of these things, we can look at them as isolated experiences, but when we look at REDS, we're really seeing sort of this cluster that's all connects back to this idea that there's a deficiency in energy that's getting in this person's way. We have Nicky here, who's really an expert as well. So I want to turn it over to you as well to add to that.
Yeah, thank you, Rachel. That's an excellent description. So the only thing to really add is that this could be unintentional or intentional. Unintentional in the sense that, you know, a young dancer, very active, as we've heard, lots of training, plus the energy demands for growth and development. So that's already a lot of energy demands. So actually it can be physically quite difficult to fuel sufficiently. So that would be, you might end up unintentionally in energy deficiency. But we also have to acknowledge and accept and be aware that there could be an intentional element to this. Dance is an aesthetic, activity. And so we have mirrors in studios. So, we are very much aware of our bodies. So it could be the young dancer thinks that this is the most important thing, potentially. And so therefore, this could lead to an intentional restriction of intake of food. And so that could be intentionally, now they're in low energy availability. But just to stress, even if it's intentional, it's not synonymous with an eating disorder. There's a whole spectrum of eating. It could be disordered eating, where they're just skipping a meal or looking at excluding certain food groups, or it could be a full-blown eating disorder. So I think Rachel's description is perfect, but just to highlight, there are different ways of ending up in this situation of low energy availability, which has the consequence of this whole cluster of symptoms, a syndrome of the relative energy deficiency state.
Okay, so that sounds to me that REDS-D is maybe not as straightforward as another medical diagnosis might be, which means it has symptoms that are sometimes obvious and sometimes a bit less obvious. Matthew, perhaps that's where the dance teacher does come in, because they are in this special position and they do spend a lot of time with the students. How do you see their role in REDS-D?
Thanks, Dan. Yeah, I do see a very special role for dance teachers here, with this special key role to play as the best observers of the children. Sometimes these teachers are in the studios with the students for more hours of the day than anybody else in their lives. And that's a very special and intimate relationship. Yeah, they see things, you all see things as they're happening. It makes it, on one side, difficult because such daily gradual changes may be very unnoticeable. But what we're talking about here, I think, is the change over periods of time, large swings of, as Rachel was saying, as either emotional aspects of the child's life, or behavioral aspects, or physical performance aspects too. All these things can and will be seen in the studio before probably parents who see their children less in, say, sport attire. You know, they've got their everyday outdoor clothes on, and where they can cover up a lot more. Yeah. Also, the dance teachers are in a position where they have information from the students themselves, plus their medical support teams, if that is in place in the dance institution. And with this, that's a good keynote. Sorry, that's a good reference later when we start talking about how it helps. The medical team might report a cluster of injuries quite close together for someone, and that, because we are talking about a big syndrome of poor health, which can lead to injuries because of the strains on the muscular and skeletal system, then that's another warning sign that dance teachers can play here a role to start looking out if they've noticed other things to go with that medical information.
All right. And Rachel, how would you advise a dance teacher to go about that? Because they are not necessarily schooled, they don't have a medical background. Why not leave this up to the medical professionals?
Of course, it's a really important point, Dan. The expectation and understanding is not for the dance teacher to be providing, health information guidance to the dancers, but really they're at the front line, like Matthew was saying. You're seeing these students every day, usually, in their dance attire, quite exposed in ways that, their parents may not see them or anybody else might see them. You are also observing, even non-verbally, how are they working? How are they kind of interacting with the work that you're offering? And so you're in a really important position. You're very likely going to be the first one that notices any change. And so what do you do with that? The idea really of making sure dance teachers are informed about REDS-D is know that your observations are important and valuable. And if you're noticing something over time, that could potentially be really important information, either, depending on the age of the student, to share with the student, to share with, if you have a health team, to speak to parents, because it all kind of can fit together in ways that can get missed. So for example, a student, as Matthew was suggesting, just consistently injured, right? Like things keep coming up, maybe they're sick a lot, maybe their immune system could be part of the concern. Maybe they're quite weak. Maybe you're noticing, they're at an age where you would expect that they would be going through puberty, and you can see that even those initial changes in the body that are observable in the studio, you're not seeing. All of this, again, not for you to make any assumptions about it, but that's information that's going to be really valuable for you to share with whatever system you're in, to the people supporting that young person. So it's really important to make those observations about the young people you're working with, and then in whatever setting you're in, considering who can I share this with, so that if it looks like they might need some support, that that information is getting to them.
Good. Nicky, do you have something to add there?
Yes, well, I think just to reinforce what my other two colleagues and friends have said, that, dance teachers, don't underestimate yourselves. You have the best powers of observation, of any profession, frankly. So, don't underestimate your skills at picking up little signs that others would not be able to. And also don't underestimate the value of your observations if you have to, take this forward. Speaking from as a doctor point of view, I listen really, really carefully, and I pay full attention and value if a teacher has made an observation about, as we've been discussing, not engaging the class, unable to pick up the steps, frequent injuries, illness, withdrawn, different behavior patterns, and not, keeping up with their peers. During this age, all the dancers will have a different exact ages of growth spurts and development. So we're not expecting them all to go exactly in step, but keeping up with the cohort you know, in terms of growth, development, pubertal development I'm talking about, and also ability to tackle harder dancing. These are so important. So as a medical doctor, I really super value these observations, as I do from anyone who is working with the dancer, the physiotherapist, the parent, and the dancer themselves. Ultimately, this is who is of center stage, literally. So that's what, and so actually I would suggest to teachers who have noticed these things, actually, depending of course on the age of the pupil, actually just ask them how things are going, just in general terms, because it could well be that something is going on in their lives which could explain everything. And the pupil might open up to them, actually, and therefore taking that further appropriately with the parent, and then conveying all this information to whoever they feel they need to touch base with, if that is you know, some sort of medical professional, depending again on your situation. I know we're going to come to this in a moment. Unfortunately, not all teachers will have the luxury, if I could put it that way, of having on the spot health support network, but actually you can always build up your own. So yeah, just to conclude and support what the others have said, that teachers are absolutely key in this process of, you know, being such keen observers of their young pupils, and really have a super important role to play. And the purpose is that we're all on the same team. All of it is for the pupil, because the pupil can feel a little bit like, oh, I'm being criticized, but no, the point is to make it positive. We're trying to help and make sure you reach your full potential.
Okay, so to me that sounds that the teacher's in a position where they are able to notice early changes. They're sort of they could be the first responders, which is a very important thing, to catch these kind of things early. I do think it's important to emphasize that that doesn't mean that if someone's feeling a bit tired 1 or 2 days, that you should start worrying. And I think every teacher can be trusted to really notice that pattern that you all have been speaking of. Maybe it might be interesting to dive into that a bit more. So those obvious physical signs, let's re-emphasize those a little bit. What can we observe? What can we see? And what is normal and what is a bit more worrisome? Maybe Matthew, you can let us know a little bit about that.
Sure. Let me start with the physical side. When someone's in class and taking part, it doesn't matter sometimes what results they've managed to do in a screening or a functional test or something, when they're in a situation where maybe the physiotherapist has tested them, right? Because that's when a one-time achievement grade or a result or a performance can be achieved. But if in the daily class situation, the young people who are training are then being observed for 90 minutes or longer, depending on how long the classes are, then that's when you guys as dance teachers will really notice habits and behavior. And let's say it can start off for me with whether a young person who's training is a person who joins in actively when marking and when listening to corrections. Do they, you know, if that person, as a general rule, is an active joiner inner, yeah, and if they over a phase of time then withdraw from that and become more passive and only save their energy for dancing the exercise when the music's playing, this is an example of a pattern of events which is always good to be passed on. Yeah.
Can I add to that, Dan?
Yes, please.
So as the teacher in the room, you get to know the dancers really well, and it's really noticing a shift that's consistent. So, you know, you can, like my colleagues were saying, you can have a bad week and, you know, somebody's totally out of it and you kind of doesn't seem focused, and maybe something was going on at home that's distracting them. But if you see over several weeks a pattern, like Matthew was saying, of being withdrawn and or attacking their work differently or not attacking it as they usually do. That's something to start paying attention to. Other things as well. Well, you don't need to be at a low weight, or you don't need to observe a weight loss to be in REDS. It can be sometimes observed that a dancer is losing weight. Again, as Nicky was saying, that sometimes the energy deficiency may be intentional by the dancer, where they've decided they've tried to change what they're eating, and it's having this consequence. They may also be experiencing, because of course it's an aesthetic sport, it's an art form. They may be checking their body. They may be experiencing body dissatisfaction, which is the reason that they're restricting energy. And so you might see them checking their body in the mirror more, and not to check if their foot is sickled, or even, if their hair is out of their face, but really sort of checking their size. You might also see them even touching their bodies in ways, sort of checking their bones and things like that. This type of body checking we do see in people, dancers who are experiencing body dissatisfaction. So that's another thing. Like, if you're seeing that sort of consistently, if they're doing that when you're giving corrections instead of listening to your correction, again, this may be that they're starting to kind of spiral into something that is connected to a deficiency in energy. So that's another piece to look out for. Again, not a one-off thing. If you see a dancer do that one time, that's a one-time thing, but really consistently over a couple of weeks, if you start to see these changes in behaviors, less energy in their jumps, less attack generally in their work, all of this together is going to start to be a reason to kind of say, hey, I'm seeing something, and really check in.
Could I just add, I think to summarize what both my colleagues have said, we're talking about trend. So yes, everyone has a bad week, a bad day. We all know that. But if, consistently now this dancer is falling behind their peers in terms of their growth and development, because as I said, growth and pubertal development is not linear and smooth and not absolutely tied to chronological age. Nevertheless, in their peer group, if they started off being one of the tallest in their class, or indeed average height, and now they've become the shortest, and also, by the way, in terms of weight, if someone is losing weight, that in a teenager, losing weight is an absolute red flag, because as a youngster, you should be increasing in height and weight. So relative energy deficiency, as Rachel says, often it's not necessarily associated with weight loss, but I would be concerned if a teenage dancer is not gaining weight, because actually you would expect them to do so if they're growing. So I think the trends and the weight, and also I think Matthew made a really good point about the functional element of it. We can measure things, but actually it's again going back to the teacher's observation. How does that look? How actually we can put them on with as I say, you can do all these fancy measurements, but functionally, how are they looking? How are they performing? And also, just to add to Rachel's comments about what behaviours to look out for, we've heard about withdrawal, not picking up steps, not engaging actively in marking. I smiled when Matthew said that. I know exactly what you mean. I always try and do it to a certain extent, marking, because otherwise you have to feel it in your body. Anyway, so I agree, that's kind of, I think, sort of a normal thing you would expect. But other things to look out for are eating patterns, because hopefully if you're teaching the dancer, well, I really hope you're not teaching them back-to-back classes, but they'll have a little break, and often the pupils will go to the side, change their shoes, whatever, and maybe hopefully have a drink and eat something. They should be, banana or whatever. But if actually this dancer is not, and if they're having eating lunch all together, if this dancer is like, where is he or she? She's not there. These are other things that the teacher can observe associated in the classroom environment, which are really valuable observations.
Excellent. So in this context, we can look at performance. We can look at, excuse me, my light just went off.
Dramatic lighting effect.
That's great.
Sorry for that short malfunction. We're trying to save energy here. So if I don't move enough, then the lights go off. So I was saying we can look at aspects that revolve around performance. So often a performance decrease or a concentration decrease. We can observe things physically. And then we have a bunch of things behaviorally inside the studio, but also outside of the studio. Is there anything there that we missed that a teacher might be observing? Maybe something more subtle. Maybe there can be certain physical responses that are
I think
abnormal.
actually picking up the corrections is quite a key one, because I was working with the dancer in trying to overcome relative energy deficiency. And the first thing she reported and noticed herself, actually, as it happened, well, first of all, she was actually smiling. So look, we're just sort of feeling miserable if you've got enough energy, you do. So number one, actually the energy, the smiles, the engagement, all that sort of thing. But also picking up the steps. And she reported that was the first thing she noticed and knew she was, you know, on that road to getting back to her health and her performance, because she said, oh, wow, I've got a really clear mind. I can remember a complicated sequence of steps. And also if I'm given, you know, some feedback from my teacher, and I can apply that. You know, so you can actually process the information and transmit it to your body. So I think we have said that already, but just to emphasize that not only is one of the early clues, but it's also one of the clues in someone's recovery that they're on the right track.
Can I just jump in here? Good, nice, Nicky. I like this. It also gives me an opportunity to tie this in with a very simple image for the idea of the REDS as a syndrome by itself. That we don't talk about, like, it's not too much to do with the actual weight, as we've just been discussing, but the situation becomes real when the seesaw goes out of sync. That the energy demands on the body, and we have to think not just dance, but their dance as well, and then all the rest of the processes which are developing through these mostly adolescent young people's lives, that all takes energy, including the nervous system for memory and for transmitting the messages into the body, and therefore when the energy is lacking, the body's so clever, it directs it where it's most necessary. So of course you have to move your body around the studio, but your nervous system is less able to cope with the function and ability to remember steps. And that's why it happens in this situation then, Nicky, when the recovery happens, the seesaw gets back into sync and the energy available is there in the body, which matches the demand for energy. Then all the systems can work most clearly, most correctly.
If I can add to that as well, you know, your energy will go, the energy that you have will go to the studio, both because you're moving around, but also because that's, you know, what you care about. And so not necessarily in the studio, but if you are in an environment where, you know, your students are also doing their academics, or you're noticing that they're withdrawing socially from other, you know, activities that maybe, you know, all the dancers do together, that's kind of could also be because, you know, they're exhausted. They don't have energy to go celebrate someone's birthday because, you know, all they had was they left in the studio. And that could also be, again, this will be very individual, and it'll depend on the ways you can observe your dancers in the setting that you're in. But it's sort of kind of a secondary, I think, outcome of being deficient in energy is now if your body is trying to be efficient and conserve energy, then what are you maybe withdrawing from, both within your body physically and emotionally withdrawing, but then also even how you're engaging with your environment may be restricted because consciously or unconsciously, because you're probably experiencing this as being exhausted.
And also, by the way, I have quite a few dancers who come to me and say, I don't think I've got this relative energy deficiency thing because number one, I haven't lost weight. It's like we've dealt with that. But also I can still dance. I can still be in the studio. I can still get through the class and maybe even, you know, dance reasonably well. But just to emphasize that point, the body's very clever. It prioritizes the movement, the energy you need for movement, dance in this case. Hooray, you could say, quite rightly, but it's just from evolution, when we used to have to run away from saber-toothed tigers and predators. So I think this is also a point to stress. I think we've dispelled, hopefully, the myth or misconception you have to be actively losing weight to be in energy deficiency. And secondly, that you can't do anything. You can't do a class. No, you could still probably just about get through a class, probably not to the best of your, well, definitely not to the best of your ability, but that's at the expense of withdrawing from other activities. And also it's really limiting your potential to reach where you could be as a dancer. So this is where it does compromise performance, but not maybe in the way that dancers might think. They might think, oh, I can't even do a plie, and that's okay. But actually you can probably still do a full class even to a certain level, but it's really sad that this will limit your potential. So I think that's important to stress. It will ultimately affect your performance, because I know dancers, well, we all are probably slightly impatient. We want to skip to the good bit. We want to skip to dance performance and think somehow we can bypass the health bit, but I'm afraid it doesn't work like that.
Just as a
Yeah.
quick, sorry, Matthew, just a quick side note. I was interested to hear a little bit more about maybe perhaps some differences between young girls and young men, if in terms of symptoms, in terms of what the teacher might observe, because it's not just the young ladies that suffer from RED.
Yeah, I'll just quickly
Right.
say, by the way, that's really, in fact, Matthew will also, but I've seen that, just to say, in my experience, I've seen that a lot. And actually one of the worst cases of REDS was in a male dancer, but everything will hold in a similar way, you know. Matthew, what do you think?
Yeah, I was going to come in with this, that when you was explaining, Nicky, so carefully about like the body will manage to do its most prioritized job, then other things are being less prioritized naturally, right? And those things in our adolescent dancers are processes which affect them for the rest of their lives. They will have a bone density which is affected during their adolescent years. They will have sexual maturity. They will have their full growth and development, in the best case, when energy is available. And the longer and the more prolonged this period of limited energy availability goes on for, I think that's when those structural things and systematic changes in the body will suffer the most. And those could lead eventually then to, not next week and next month, but way down the line, as adults, when they're becoming professional dancers, when they get multiple stress fractures coming, or when the hormonal system is, suffering from that. Yeah.
No, we
So,
did this. Sorry, Matthew, I cut you
That's
off. I
fine.
hope you can edit this out.
No.
In fact, on that point, I did a study many years ago exactly on this, looking at young dancers in training, and this was specifically female dancers, but nevertheless, exactly to pick up on your point, Matthew, that those who were in energy deficiency, surprisingly or not surprisingly in that way, didn't start their periods when you would expect, very delayed start of their periods. This compromised their bone health, and absolutely that's not just for the here and now, this is not a great thing, but for the future. So if they did manage to get into the professional ranks, then they're already at much higher risk of bone stress injuries, which can be career ending. So I think that's really sad to see.
And that's the same for men and women, right?
Yep.
I mean, I know that one of the predecessing syndromes of REDS was female triad, right? And now it's become way more than that. So in some people's minds, it might be a little bit like more biased towards only ladies can have a female triad. Well, yes, maybe, but in the true sense of that as it was then, but because our description of REDS has now expanded and become more clear to involve many other things, it just as much bone health of every gender, and structural development of every gender, and sexual maturity of every gender too.
Rachel, let's go back to the studio because I'm interested to hear more about that initial response that a teacher can have, and if there's anything to add, which we haven't mentioned that. So I'm a teacher. I now know how to recognize REDS-D. What can I do?
Sure, it's a really important question. So first of all, it will really depend on the place, the space that you're in, right? Are you in a large organization that has a robust healthcare team on site? Are you a private studio owner and you're training young dancers yourself, but really are not kind of connected to a health team directly? Also, within your community, do your dancers have access to healthcare, or are there limitations in terms of their health access? So in all of those situations, the first thing to do, you're noticing a pattern, you're seeing these different things that all of us have been talking about. I would first, for most dancers, start with the dancer themselves. I mean, obviously there's going to be unique exceptions, but starting with the dancer themselves, hopefully you're already having regular conversations with your dancers, checking in. How are you doing? How is it going? Having a sense of their life outside of the studio too can be so helpful. You know, if they have a sick loved one at home, right, that's going to come into the studio. Of course, they're going to try not to bring it in, but it can be really helpful to understand. So in your check-in, kind of just, how are things going in the studio, out of the studio, checking in on their goals, what they're working on, all that, as dance teachers, we want to be doing in general. But then sharing with them, I've noticed, maybe sharing what you've noticed if they're looking a bit tired, or seeing if they have any concerns about their work, see what they share. They might provide some key piece of information that is going to be really valuable. Yeah, they're doing renovations in the apartment above mine, and I haven't slept in 2 weeks because like they start banging at 4 a.m. every day. Like, you're like, oh, okay, yes, you look exhausted, I can see that, right? So sometimes it's just that, but other times it might be where they are going through something emotionally, or they're not sure, and then that's a moment to say, well, okay, well, this is what I'm seeing. Could we figure this out together? I was thinking maybe just speak to your parents about it, or to the health team if you're within an organization where you do have access to a health team. So that's kind of like the initial idea, is to start with the dancer, because also the other thing is you want the message to be the dancer, like, I care about you, I care about your dancing, but I care about you. And if you're seeing any changes, because dancers might be like, I've done something wrong, and might immediately go to like, oh, I didn't work hard enough in class. It's not what it's about, but it's saying like, are you okay? Because that's my first priority before we start talking about your work. So that's certainly the first place I would typically start.
And Nicky, as a healthcare professional, how would you advise a teacher to guide someone to look or seek out medical assistance?
Well, just to reflect what Rachel put that so perfectly, because dancers, we are very self-critical. So if a teacher says, goes to check in, they might take that as a criticism. But I thought that was beautifully put, Rachel. Thank you. That's also, as a doctor, how I approach it. I want to know. Tell me this is a team. Tell me, but then moving on from there. So say now you are the teacher, and actually you are worried, and the dancer has given you, there is some concern, and maybe also the parents are sharing and saying, yes, actually, we've noticed she's she's not eating all her food, or she's makes an excuse that she's eaten somewhere else and not having the family meal, or whatever. So now you're in the situation, actually, you are worried. What do you do with that information? And what happens if you don't have that? So definitely this is important information you have, for sure. And so if you're in that nice environment where you can connect with a health team, great. But otherwise, if you are, you know, a teacher sort of going solo, as it were, I appreciate that's quite a stress. You've got a lot of things to do, but I would encourage you, this is important information you have. And so trying to build up your own network. You know, who are the doctors that understand a little bit about dancing or will listen to you, or the physiotherapist or a dietitian would be good to sort of get in contact with, and maybe even ask if you're speaking with the parents, because the parents might also know. Oh yes, actually we have a friend whose daughter found this doctor very helpful or something. So that would be the next step, to try and find what that network is. And I think another thing is, I know dance teachers have so much going on, but also you know, there are structures about syllabus and classes, but make sure there is some, either within your organization, or if you're running your own studio, and maybe you're getting other teachers to come in and teach now and then, there is a written sort of policy or whatever is what to do if you're concerned about a dancer, and this is the tick list. Make sure you've spoken to the dancer and to find out. Make sure you've communicated appropriately, and at that point, you know, if there are some top tips, who are the people to go and seek out further medical help. But so making your own team is really the crucial thing, with the dancer at the center all the time. That the dancer, like Rachel says, really to emphasize that the dancer doesn't see this as a personal criticism of them. It is actually people care. And we want to see this individual dancer reach their full potential. Whether they go on to become a professional dancer or not, this is a vital opportunity for any youngster to, you know, be the healthiest that they can to reach whatever goal they want to.
Excellent. So we spoke a bit about recognizing it, spoke about the first steps you can take, seeking out help, having a policy in the background you can fall back onto. But teachers and staff are also part of creating a culture in whatever institution you're in. And it might be very interesting to figure out what parts of creating a culture can be helpful in prevention. How can we make sure that Red D becomes less prevalent? Rachel, could you let us know what your thoughts are on that?
Sure. Well, first I'll just go back to, you know, in terms of building a culture, having a policy in whatever type of organization or studio you're part of is going to be a really clear message about the culture here. So wherever you are, you know, if there's a standard, like I have concerns, I need to get reassurance from a healthcare professional before I can allow you to continue to train. Like having that standard of like, I need to make sure that it's safe for you is a very clear message. I care about my dancers as people. And when we're talking about young dancers, this is really the potential consequences are on the rest of their life. So we're, you know, that's a great first step in terms of, I think, this culture of prioritizing health. So if you don't already have something like that, thinking about what are your standards in terms of what you're going to require for people to come into the studio and work with you. In terms of the culture within the studio, within the training environment, my first thought is what you're modeling, right? So are you hydrating? Are you nourishing yourself between classes? You know, you don't you need to go out of your way to show, you know, your dancers that you're eating, but it does help if they're seeing you eating. If there's an interruption or an extra meeting with the dancer, you're checking in. Do you have time for lunch, or do you need a bit of extra time because we've had this extra meeting? So modeling that, normalizing that fueling throughout the day, even when you get busy, is really the priority, is very, very important for dancers. So you can do that yourself as a dance teacher in modeling that. And then also being also thoughtful about languages, you know, Nicky was saying as well, like dancers can be really sensitive about how you offer information. They really want to keep improving, and they will reflect on what they can do, and often do it, you know, and think about it over and over again. And so how you're offering information, just being thoughtful and noticing how people respond to it. And sometimes, you know, what you said is perfectly clear, but it's how they're receiving it. So that's something, you know, if as you get to know your dancers, noticing like what information appears to kind of be well received, and what, you know, when you're talking to your dancers and hearing their concerns, what have they heard from what you offered? So those are some initial thoughts, but I'm sure my colleagues have other ideas as well.
I'd like to add that I think a part of the culture is also the systematics, so like the timetabling. So as an organization or as a school owner, the dance teacher or the people responsible for planning the day of our students' lives can make a huge difference. If there's a morning break, if there's a lunch break that's adequate for a good meal and time to digest before starting again. Yeah, I think if they can see by looking at the timetable that there's thought put into that, space for fueling and space for regeneration between classes, that's already made a big statement about the institution or the school's idea about a stand making about the culture.
Nicky, do you have something to add there?
Well, just to really sum up what my colleagues have put so eloquently, that making it part of the culture, so it's in the timetable, it's prioritized, because dancers, and also giving dancers praise and saying, you know, you as dancers are super organized, you're going to listen to feedback from your teachers, you're going to get make sure you got the, you know, the best shoes and all this sort of thing, but actually don't overlook them. One of the key things is yourself. Are you looking after your health and your fueling? And so if, like Matthew says on the timetable, it's right, this is a break, this is a lunch, and the teachers can help and check, you know, okay, now after they've finished the class, right, now we have a break when I hope you're all, it could almost be said, you know, very positively with a smile on the face, hope you're all taking advantage of this break to, you know, eat your banana and get refueled, ready for the next class, in addition to changing your shoes, whatever you need to do. So, you know, making it part, you know, encouraging that, and like, okay, it's lunchtime now, go and have a good lunch and make sure you're, you know, you're fueled up and rested for the next class, and checking in when they come into the class. Hope you've already all had your lunch and your refueling. So giving them little cues to remind them. That's, you know, like cues when to come on and off stage is the same thing. Cues when to go and do your refueling and reinforcing in that, and making the time, as Matthew says. That's really crucial. And setting and being a role model. You know, you yourself, if they can see you, as Rachel said, obviously you don't want to make too much of a performance, but it's hopefully it is natural anyway that you are eating lunch and you are having a banana yourself and whatever. That's yeah, super important. So I think, and just talking about it as part of the training, because I think dancers and athletes, indeed, when we say about training, we think, oh, that's just the time in the studio, but training is also, have you timetabled in that, within that training, the time for fueling, the time for recovering. It's all part of it. So again, explaining this, that this is all part of being a good dancer, getting the right balance of everything. That's crucial, and hopefully support them in their health and, as I say, their future, you know, wherever they want to go, be a professional dancer or not. It will help them, you know, reach their full potential.
Right, so you have to normalize young dancers to take good care of themselves.
Exactly.
Excellent. All right, I think we have gathered a bunch of information. It might be very interesting to hear one more time from all three of you to see if we missed anything, or figure out what is that one key message that you would like our viewers today to take away from this discussion. So let's do Rachel first, Matthew second, and then we'll have Nicky last.
I think the biggest takeaway, if listening to this, is as dance teachers, you know your dancers really well. And that is a really important role, and they really value and respect you. And if you're seeing consistent changes in their behavior, in their appearance, keep an eye on it. And if you have that spidey sense, there's reason to check in. There's maybe no one else in their life that is has this daily time with them in this way. And if you do see something and you may not be sure, but just observing it, being curious, not making any assumptions, but speaking up about it and exploring it so that it can get addressed before it turns into something worse, can be quite vital in supporting a dancer's short-term and quite frankly long-term experience in dance, and even after a dance career.
Thank you, Rachel. I would encourage you all, just as complex as the syndrome itself is, so will the solution be, yeah? And each and every one of you is an important wheel in that machinery of help and support for our dancers. And if you see these observations, if you have an idea and you're not sure, because we're not talking about making a diagnosis, but if you're unsure, pass it on anyway to the medical team, to the parents, or whoever's in your support region, because you will have done your part, yeah? And you will know inside that that's the right thing to do with the information, yeah? And it could be helpful, and if it's not, then nothing's been harmed, yeah? But it's better to act on your gut feeling, really, yeah, and your observations, which, as we say, are so professional, that it's better to pass that on and be part of the team.
Yeah, so just to echo what my colleagues have said, that, you know, dance teachers, you're amazing. You know, reflecting on the dance teachers I've had, you know, from my young age, you know, dancers do respect you, and you play a vital role, and you have the expertise. So don't doubt yourselves. You have the expertise, the powers of observation that can be really crucial and critical in helping these youngsters in front of you, you know, reach their full potential, which of course is what you're trying to do, I know, but don't minimize your exactly your powers of observation and those useful those inputs you can give, and remembering and reflecting that, you know, it's going to be really positive for each of those youngsters that you're teaching to, you know, engage, encourage, observe, and, you know, pass on information where indicated. So yeah, fantastic. Fantastic to dance teachers is what I say.
All right. Thank you so much to all three of you for your time, for your expertise. And thank you very much to our listeners. Hopefully this panel discussion has given everyone something to think about. Now, if you do end up having questions, or maybe you feel like we missed something important, or you have other remarks, we do have a little survey. So you can use the link in the description or the QR code that will be provided to fill out a very brief, simple survey. We will be very thankful for your insights. Our expert panel will then also answer these questions in a follow-up video that we will make available to all of you later. For now, again, a very big thank you to Rachel, Matthew, and Nicky. And again, thank you very much for listening. And thank you for your investment in your student health and well-being.
Thank you,
Goodbye.
Dan.
Thank you, Dan.
Thanks.
Thank you.
Take care.